am really excited to be joined by Ruth Zakarin today, the Executive Director of the Massachusetts Coalition to Prevent Gun Violence. Ruth, I'm excited to talk to you not only because of the incredible work of your organization, but also because you have been an incredible thought partner to me. If you could just set sort of like what brought you, I know you're the first staff person, full-time staff person that the coalition hired. Can you just talk about the genesis of that a little bit?
When Sandy Hook happened and you saw gun violence come into an elementary school, that was a moment for everyone around the country.
Yeah.
It was a moment of recognizing that not only was that horrible, but too many children in too many communities are being harmed. While we have lower rates of gun violence than most other states, depending on which statistic you look at, we're either the safest or close to the safest in the country around gun violence still happens here. And in certain neighborhoods, those rates are high enough that people have to worry about the threat of gun violence on a daily basis. And that's not acceptable. And gun violence has become a very politicized issue.
Of course, yeah.
But for me, it really is about safety. We may not all agree about how we get to that place of people being more safe. We know that we're losing over 40,000 people a year to guns and gun violence, and we know that those deaths are preventable. You can't really quantify the trauma of gun violence just by the number of deaths, even though that is horrible and terrible, that there are so many more people who are shot and wounded, and they survive, and they survive with the trauma of gun violence, that there are so many people who've experienced a loss and that trauma, who have witnessed gun violence and that trauma, or who live in communities where gun violence is way too prevalent and that's trauma. People have a right to safety. They have a right to not get shot. And there were a group of people from faith communities, from some community-based organizations like the Louis D. Brown Peace Institute and Peace Boston, JCRC, and many leaders from many faith communities that really came together in community, wanting to know what we could do to keep our kids safe here in Massachusetts. And so that group came together and did a tremendous amount of advocacy to move something forward. And that was the 2014 Comprehensive Gun Reform Bill, which really shaped a lot of the ways that we think about access to guns here in the Commonwealth. And that group decided to stick together and stick it out, even after that bill got passed, because they recognized that there was so much work that needed to be done.
As a parent, I think sitting with my kids who would see this on the news and saying to them, they would ask, is this going to happen in Massachusetts? And I would always answer and say, Massachusetts is one of the states with the strongest gun violence prevention laws. And it was something that, I don't know how that landed for them, but it felt really important to be able to say. I remember being at a rally, though, on gun violence prevention. It was after a mass shooting, and I heard a young leader speak about gun violence and really reframed it about mass shootings versus the everyday occurrence of gun violence that communities face. And so I'm wondering if you could talk a little bit about sort of the contours of the coalition in that way, because I know that what we see on television and what we experience day to day in our communities in Massachusetts too.
The kind of gun violence that you tend to hear about in the news are the mass shootings that happen in public spaces, and that isn't in any way the whole story when it comes to guns and gun violence. And so long ago, that group that came together made a commitment to really thinking about gun violence holistically and recognizing that what's in the news is not a reflection of how guns impact our communities. And there was an effort to really think about, where does a coalition need to show up? Neighborhoods and communities that are experiencing high rates of gun violence, the environments where gun violence is more prevalent. A lot of folks don't realize that the highest number of deaths from guns are firearm suicides, which is incredibly important in a conversation that's not always being had well. Access to guns makes someone who is having a mental health crisis, it increases the chances of lethality of a suicide attempt exponentially. And that's something that we really need to talk about. And for me, as someone who spent all of my adult life working with survivors of domestic and sexual violence, the other piece I always want to lift up is the intersection of guns and domestic violence is another really critical issue that we need to focus on very intentionally.
There's a lot of layers when we're talking about gun violence, that it's mass shootings, it's about guns and sort of comorbid mental health issues. And so I want to talk a little bit about how the coalition approaches that.
Understanding gun violence is a public health crisis. It is driven by racial and economic disparity, and the need to take this holistic approach, investing in community-based solutions and lifting up data and research at the State House, thinking about how we strengthen our policies around guns and how we invest in our youth, particularly system-involved youth, as being foundational to violence prevention. And we do a lot of budget advocacy, and we're also starting to do some more municipal advocacy, so with municipal leaders, mayors, and city councilors. So advocacy being one pillar. Another being outreach and education about the trauma of gun violence, the intersection of guns and domestic violence that are based in facts and data, and push back on misinformation. We have a full-time organizer who's really focused on communities most impacted by gun violence to engage with those communities around what solutions look like for their communities. We actually have a series of trainings for young people. And, how do you walk into the State House, mayor's office, city councilor, and feel grounded in what you want to tell them?
There's not one focus of sort of saying, okay, we're regulating guns.
When the coalition started, it was a group of volunteers that were rolling up their sleeves to convince legislators that change was needed. Legislative advocacy is a really intense piece of work, as you well know, and that policy change is critically important, but not the only kind of change that's needed. Prevention is about making sure that people have what they need to be safe and well. Doing that legislative advocacy and doing deep work in the community. And that's how we move the needle,
right?
Is when you take a multifaceted approach to an issue. Think about policies related to guns that are not just based on arresting people in the carceral system, because we can't arrest our way out of this problem. And if we're just using the carceral system as opposed to really digging deep into the root causes of why guns are so prevalent, particularly in certain communities, why people pick up guns, why people don't feel safe, then we're really missing a huge part of the conversation. So that's a lens that we try to bring to all of our advocacy work as well. Folks talk about the fact that Massachusetts, compared to other states, had already had really strong laws around guns, and that is true, but there are still shootings and deaths and trauma that are happening all the time. And for us at the coalition, we see every shooting as both a crisis and a call to action. And we know that there are certain communities in the Commonwealth that still have incredibly high rates. Even if the rate for the entire state is lower than other states, in some communities, that rate is still very high. And these are preventable deaths. We just have to do the work to prevent them.
You're talking about how we understand data. And how we look at data and how data informs the work that we do.
It's kind of built into a number of different aspects of our work. There's even a part of the omnibus bill that just got passed to really look at not just how do we collect data, but how do we communicate that and make it available. And it's data collected from guns in the aftermath of a shooting or a crime. And a lot of our member orgs talk about wanting to know where the guns are coming from. And we need that data to be available. So in the bill, there's this piece around a public dashboard to make that data available widely.
I wanted to use that as a way in to really talk about the legislation. I don't necessarily walk away with an understanding of what the omnibus bill was to help us understand what were the central things that the coalition wanted to see and what passed, what was in that.
Yeah, and it's a 116-page piece of legislation, so there is a lot in there. Some of the things that we were most focused on and we were excited to see included in the bill was this piece around data from crime guns and better understanding where the guns are coming from. And something that is, I think a lot of folks have heard about, but it is a newer issue, which is ghost guns, kits that you can get through the mail. It's up to 80% of the parts of a gun. Someone assembles it at home. It doesn't have a serial number, is therefore untraceable and considered a ghost gun. Those have become incredibly more prevalent. So we really wanted to make sure that we had ghost guns as a part of this bill, and we were happy to see that included as well. We'd also talked a lot about extreme risk protection orders, which was a bill that was passed in 2018. The coalition was super involved, temporarily removes guns or access to guns from those deemed to be at risk of harming themselves or others. When IRPA was passed in 2018, the people who could petition for an IRPA were family members and law enforcement. And the omnibus bill expanded the categories of petitioners to include medical and mental health providers, as well as school administrators. So it just gives more people access to a tool that it can help provide safety for someone who is at risk of harming themselves or others. So we were excited to see that included. And another piece for us that we talked about with the leaders at the State House who crafted the bill all along was the issue of how do we best address the violence that's happening in communities. And to that end, we had a conversation about really understanding how we're funding community violence intervention work throughout the state and how are we resourcing those communities. So in the bill is to create an oversight board that's really going to take a deeper dive into how we fund these programs throughout the Commonwealth, and to make some recommendations for how we can do that in a way that is both effective and equitable.
That's great. And, I just want to underscore sort of the evolution of this work, that it wasn't something that just happened over the last session, but that you're talking about how the data has informed the policy making to inform the expansion of the extreme risk protection orders, things like that. And so it's really like this evolution of policy making.
Yeah, there were, I think, 12 listening sessions that were held throughout the state, 6 or 7 months of these listening sessions. And some of it is finding agreement, and also some of it is having priorities, whether it's policy or community-based priorities that speak to the different kinds of work and the different organizations that are involved with us. You're always going to have folks who have different parts of the work that really resonate with them or join with the things that they work on. So for us to have a holistic approach means that we're able to bring more folks together because they see their priorities reflected in different things that we do. What we do on a state and local level matters greatly. Hate is way more lethal when coupled with easy access to guns. Part of the work of addressing gun violence is addressing hate as root cause of some of the gun violence that we have been seeing.
I want to turn the conversation a little bit to what we are seeing right now. I know that there is an effort to stop the legislation. There is a repeal effort that I think is moving forward. You just sort of level set, like what should we know about what's happening and how can we get involved?
Well, a couple of things to say about that. And one is, I'll talk a bit more about what's happening moving forward. But what's happening now is that the legislation is being implemented.
Right. We talked about that.
The governor has signed an emergency preamble ensuring that this legislation can be implemented. That is what we're focusing on, is actually implementing the life-saving policies that were included in this omnibus bill, as well as educating folks about the critical importance of the bill. And I appreciate being able to speak to some of those core pieces that we were advocating for. Folks should know what's in there, and it's important to understand why those policies are so important. So that work is happening, and that is work that we will continue to help drive and be involved with. And so in addition to folks understanding what is in the legislation, us working to make sure that the components of the bill are implemented and implemented well, is to make sure that we protect this critically important legislation. We do know that there are folks working to get something on the 2026 ballot to repeal the law in its entirety. And we are going to work very hard to ensure that does not happen, because we know that this legislation will save more lives and will create more safety. And so our work is to make sure that we move the legislation forward in terms of implementation, continue to think about strengthening our policy, but also to protect the gains that we've already made. As I mentioned before, we know that the work of the states is more important than it has ever been. As there are questions about what's going to happen on the federal level, we're going to continue to focus on what we can do here in Massachusetts. And we're also going to be doing more to educate people about data and facts so they can be ambassadors for this information. They can be equipped with the information that they need to help us not just educate the general public about what is in this legislation, why it's important, but what do solutions look like in general? And how do we push back on misinformation about gun violence and keep the conversation based in data and facts? And one of the most common myths that we hear about guns is that guns are what make you safer. And the data and research overwhelmingly tell us differently, that the presence of a gun in the home makes the chances of a domestic violence situation becoming lethal and increases it 5 times. It increases the risk of someone who's in a mental health crisis successfully completing a suicide attempt exponentially. It also increases the chance of children harming themselves or each other, particularly when those guns are not stored safely. And so one of the really key messages that we want to get out there is that guns, in fact, don't make us safer. It's become a part of the ethos around guns, is that safety equals having access to a gun. But in fact, that is not the case. And as we see our communities flooded with guns, we now have more guns than people in this country. We are seeing rates of gun violence increase as a result. And so part of our work is to counter that misinformation. And that's going to be an increasing part of our work, is to make sure that people understand that data, that research, what it's telling us, so that we can learn from that.
You're saying the data doesn't show us that guns make us safer, but that the policy intervention is not to take guns away from people or impede on people's Second Amendment rights. It's about safe gun ownership, that you're talking about the extreme risk protection orders, ensuring that people who are most at risk through professionals are ensuring the safety of it. So I just want to tease that out a little bit, because I want to just put the policy next to the data a little bit.
There's definitely been some responses to this legislation that have been, very much, they're trying to take guns away, or this is an infringement on our Second Amendment rights. And it's not about removing guns from folks who are legally owning guns. It's about creating some infrastructure for an understanding from the data, from the research, where's the greatest risk and how can we mitigate that risk?
As JCRC was a part of the coalition and continues to be, really just grateful to be in partnership through your thoughtful leadership and through the thoughtful leadership of the coalition members. And so I really want to thank you for taking the time today to have this conversation, to help us understand the landscape of what's happening, to understand the data, and really be more expansive in the way that we think. So thank you so much.
As I always say, it really is about the community that you keep, and I'm glad to have you as a part of my community.
Thank you.